Now, the recent cholera outbreak in some parts of the country caused major alarm, forcing health officials to undertake measures to arrest the situation. Hardest hit was Wajir County, where the disease has claimed the lives of 45 people over the last 8 months. Our crew visited the county to assess the scale and scope of the outbreak and filed this story.
Wajir County is vast, the third largest in the country. Most of the places here are parched but not its potential. Even here, disease becomes an enemy of progress. Cholera has been prevalent for 8 months.
Awali, watu walikuwa hawajagundua hii ugonjwa hii inaitwa kipindupindu. Kwa Kisomali inaitwa daon. Iko watu iko na ugonjwa hizo wanajificha. Na kitu sio kitu aibu, ni kitu mgonjwa ambao unaletwa na Mwenyezi Mungu.
Investigations that involve tracking those infected with the disease show that the outbreak started from Wajir East Central Division, spreading further to other sub-counties. Eldas is one of the 6 sub-counties of Wajir, the latest in the spreading line from February. On April the 2nd, when we visited the CTC, there were 30 patients quarantined, 2 tents with 25 beds in Eldas. However, the area leadership says the situation is at crisis level.
There are quite a number of people who still cannot access the very facility. The issue is not even the number of people who are affected. The issue is not even the number of deaths. The issue is the gravity because of poor health facilities, because of hygiene. It has been around. In terms of scope, this is the high time that the national government and other international agencies, of course in conjunction with the county government, actually should come in and bring this issue to an end once and for all.
An Ola division in the pockets of Wajir West teems with life. Shallow wells, dams, pans and water points are a shared resource for the people and their flock. Market contamination is visible to the naked eye, but Vibrio cholerae, the bacteria that causes the disease, is not. Epidemiologists would have to test the water sources for high fecal matter and confirm that it is the source. 55-year-old Mohammed Hussein says he has been ailing. He tells us he got the same ailment his 9-year-old son Shimoy Hussein had while taking care of him. He hadn't been tested for cholera. County health data says that no cases of cholera have been confirmed here, just 3 normal diarrhea cases.
Hiyo ugonjwa inaletwa na chafu na ile maji tunatumia kutoka mto hii.
As at the end of March, there were reports that 45 deaths were confirmed, with 2,000 people being affected by the disease. This is Eldas, at the middle of Wajir North and Wajir West. Cholera hasn't been common in this area, but after the recent outbreak, it is feared that it could spread from this region to Wajir North, right behind the hills.
The scope of its spread is no exaggeration. This disease is of an epidemic nature, spreading in the county of pastoralists with frequent movement within and without its borders. Rukia Malim Kahir, the county health executive, says the county government, with partners such as Red Cross and MSF, has done all that it could to contain the outbreak.
This is for Wajir Central, and maybe the surrounding, those who can be able to be reached here. Okay. Any other part of the sub-county which we feel that the cases are going high and qualify to have a center, then the center is being. So far, El Nur is one of them. It had a center with the 19 patients, the last one, but closed now.
What actually caused this?
From the investigations, that was a traveler, probably.
And we're already seeing the numbers are reducing. And usually, in most places, we were able to even close the cholera treatment center in 2, 3, 4 weeks max. And it's easily treated with fluids, because this disease, dehydrates the body. But the more important thing also is to trace the persons who've been in contact with the infected person and see to it that they have been given medicines to clear the disease from their body.
Dr. Ahmed Aji, the epidemiologist, tells us that cholera symptoms and spread cannot be taken lightly. Cholera is spread from fecal matter ingested orally, in principle indirectly, especially if hands are not washed properly at the 4 critical times. The symptoms are severe, including uncontrollable watery diarrhea, vomiting and dehydration, sunken eyes and other complications.
The cases we have treated, about 53% of the cases are females. Children, yes, the school age going children, but they are not very many.
short-term plans. One of them is now to make sure that people are educated, the other departments to play their part, like the town administration buying exhausters, increasing their capacity. Then the long term is to get a good sanitation.
Community awareness and acceptance of change is necessary, especially of habits such as treating water for domestic use being critical. In the hours of the Wajir dusk, the quest for water begins again. It's daunting. Most of what they find may not be clean enough, but either way, life must be lived. Dorcas Wangira, KTN News, the County of Wajir.